Wonderful. So just to set the stage, we're going to just do a quick little review of what is the typical journey and the symptoms that many people with narcolepsy may experience. So we're going to go over the importance of the sleep-wake cycle, narcolepsy and its symptoms, how it's a disruption to life, managing this disruption, combining lifestyle changes with treatment, how to advocate for your care, and definitely please send in those questions because I do want to make sure that you're getting the most out of this session. So sleep is supposed to be a natural restorative cycle that is fundamental to your good physical and mental health. So I'm just being told that we had to redo the intro because you guys weren't able to hear. I'm so sorry. So just another intro is I'm Dr. Anne-Marie Morse. I'm a neurologist and sleep medicine specialist. And I am super excited to be here today to speak with you and share some perspectives from a physician, as well as with a very close friend and colleague of mine, Alyssa Temple. Alyssa, please do a brief introduction for yourself.
Yes. Good afternoon, everybody. Thank you so much for being here this afternoon. And I'm very happy and honored to speak with everybody about my perspective and experiences through my journey to being diagnosed with type 1 narcolepsy. Later in the presentation, I will share with you my journey and experiences. I started out working as a research nurse with Dr. Morse, ironically, on narcolepsy clinical trials. And this kind of led to my path of diagnosis. So thank you for having me, and I look forward to speaking with everyone.
Wonderful. In order for us to set the stage of how we're going to kind of go through this journey together today, I'm just going to review some basic information that many of you may be familiar with, but maybe perhaps might leave you going, that might be relevant to me, and I haven't thought about this before. So today we're going to cover the importance of the sleep-wake cycle, narcolepsy and its symptoms, how it's a disruption to life, but how are you going to manage that disruption, combining lifestyle changes with treatment. We're also going to help in trying to maybe develop a few tips on how to advocate for your care. And we want this to be an interactive session. So please send in those questions throughout the session. So this way we can try to answer as many as possible. When you're talking about sleep, sleep is a fundamental process that needs to occur in order to have good physical and mental health. The sleep-wake cycle refers to this pattern of sleep and wakefulness across 24 hours. And restorative sleep can impact the way people feel and perform the following day. Narcolepsy, however, is a chronic, lifelong neurologic disorder characterized by a disrupted sleep-wake cycle. In people living with narcolepsy, the lines between asleep and wake are blurred, and many times they're experiencing these hybrid of symptoms. I frequently will refer to patients as the fact that they're experiencing a lot of REM dissociative features. So they're having fragments of REM sleep, maybe that vivid dreaming or that REM atonia with wakefulness. It explains a lot of many of the things that we're going to discuss in a few slides, such as sleep paralysis, sleep-related hallucinations, that fragmented sleep that maybe your sleep is intruding during the day, but wakefulness may be also intruding at night, which may explain why many of you may have even gotten a misdiagnosis of insomnia. Because of this disruption, many individuals with narcolepsy are unable to achieve this normal sleep-wake cycle. When we look at the normal sleep-wake cycle, an individual should be cycling every 90 to 120 minutes into REM sleep. And as you notice, in a typical sleep-wake cycle, there's a short amount of REM sleep duration in the beginning of the night. And as we progress throughout the night, that becomes more. The inverse is true for your slow wave sleep or your non-REM 3 sleep. You spend the biggest amount in the beginning of the night, and that becomes less and less as the night progresses. This type of sleep-wake cycle ensures that an individual gets the right amount of cycles of sleep or different pieces of sleep for them to wake up and feel restored. Unfortunately, in an individual who has narcolepsy, they very frequently sleep throughout the night, and they're entering into REM sleep sooner than they should, and many times cycling back into it very frequently across the night. One of the things that I typically will describe to my students who I'm teaching about sleep architecture is that when I'm reading a sleep study of someone who has narcolepsy, some of the earliest signs, even before I do the multiple sleep latency test evaluation, is the fact that when I'm looking at a page of sleep, it very frequently looks confused, meaning that I see fragments of different stages of sleep all in one stage. And that, again, is just kind of representative of some of the challenges that are occurring for individuals who may have narcolepsy. When we're talking about narcolepsy symptoms, I think all of you may be very, very familiar with all of these symptoms, but I think it's important to just line them out and for us to really just put this to set the stage. The most sensitive symptom, excessive daytime sleepiness, meaning 100% of people of narcolepsy have this symptom. Cataplexy. We frequently refer to this as transient episodes of loss of tone. But Dr. Plotzy back in 2011 published a beautiful paper that helped it give us more insights about cataplexy, especially in children who are developing cataplexy, where those symptoms of cataplexy actually may be active motor phenomena. And they can experience things such as eyebrow raising or tongue thrusting, and sometimes even abnormal movements. Some of us may not have realized that, and that may have been a part of your journey, and you may not have recognized it and said, no, I definitely don't have cataplexy. So maybe you might be rethinking a little bit of your journey today. Sleep-related hallucinations as we're falling asleep or waking up, seeing things that may not be there. Sleep paralysis as I'm falling asleep or waking up, feeling frozen or stuck, like I can't really move. Many times people will associate the sleep paralysis and sleep-related hallucinations together, and some may even describe feeling like they're having an out-of-body experience, seeing themselves back. And the final piece is that sleep fragmentation. Just as I described, you have your fragmentation of sleep during the night, but then you're also having sleep intruding during your daytime. We already mentioned that excessive daytime sleepiness is the most sensitive symptom, meaning that it occurs in every single individual who has narcolepsy. It sometimes can be misleading and lead people to the diagnosis of things like obstructive sleep apnea, or just told that maybe you're not sleeping enough because you're having a sleep fragmentation across 24 hours. It also can be something that has many different faces. We recognize in adults, we most typically think of it as the person who's falling asleep at their desk. But sometimes it's not that. It can be irritability, it can be hyperactivity, because I know if I keep moving and being active, that I'm not going to fall asleep. And so it's important to reflect on that, and that being a part of what you may have experienced in your own journey. We've already talked about sleep fragmentation, and that this is many times frequent arousals that are leading to that reduced sleep efficiency, many times leading to the fact that you don't feel well restored the following day. Narcolepsy is a tremendous disruption to life, day and night. The impact of narcolepsy is felt professionally as well as personally. When I'm asking my patients about the impact of narcolepsy, I generally don't limit it to asking them about their Epworth Sleepiness Scale, because I have yet to have a patient walk into me and tell me, hi, Dr. Morse, my Epworth is a 16, therefore I have a problem. Most typically they're coming in and they're telling me, Dr. Morse, I'm at risk of losing my job because I just can't get there on time. I'm at risk of getting a divorce because my husband and I just can't get romantic anymore because I'm just exhausted. I have to choose between cooking my children dinner and doing laundry. I just can't do both. That's the reason that we really need to pay attention to the symptoms, not just because of what some scales are telling us, are saying there's a problem. And again, this disruption extends to the nighttime hours where people feel like they're almost going crazy of that. How can I fall asleep so much during the day and I just can't stay asleep at night? So I think now I want to really turn it over to Alyssa to please give us some information about what your journey to diagnosis was like.
Sure. So my journey to diagnosis was a long one, as I'm sure many others can relate. It took about 17 years from the onset of my symptoms to diagnosis. It started, when I think about it, my symptoms began around age 15. I was sick with some kind of illness. The doctors were thinking that it was possibly mono. And during that time, I remember being out of school for about a week, not feeling good, but also sleeping all the time. And once I, quote unquote, recovered from, this illness, I started going back to school. But I would only go back to school half days because I would tell my parents I'm so tired. So they would pick me up and bring me home and I would nap. And then they said, okay, you need to go back to school full time. So I started going back to school full time, but I would go to the nurse's office and nap because I just could not stay awake. I was so tired. And this, went on for a period of time until the point where, my parents were like, you need to go back to school. I think they thought at the time, that I was trying to miss out on school. There was something going on that maybe I didn't want to be there. But the sleepiness, continued to occur. At that time also is when I started having more vivid nightmares. And they felt very real. And sometimes I had a hard time distinguishing between what was in my nightmare versus what was reality. And this continued on, through the rest of high school. I was very active with sports, so I tried to push myself to continue with sports to keep me active, because in my mind, if I stayed active, that would keep me awake, and keep me from trying to fall asleep, or having to fall asleep. After high school, when I started college, I slept all the time. My roommates actually used to tease me about sleeping and the amount of time that I slept. And my excuse at that time was, well, nursing school is hard, clinicals are hard, they're exhausting. That's probably why I'm really tired. But I also struggled with staying awake during lectures, especially if they turned the lights off to give a presentation or something. I would constantly fidget in my seat or, jot notes down, doodle to kind of keep myself from falling asleep. After college, I started my nursing career. And at that time, I was working night shift and day shift and kind of switching back and forth, working 12 to 16-hour shifts. So the excuse then was, well, it's exhausting flipping back and forth and working those long hours. So that's probably why I'm really tired. Shortly after that, I got married and had 2 children within 18 months of each other. And then the excuse was, well, when you're pregnant, you're exhausted, you're tired. You have 2 kids, it's exhausting. You're working full time. That must be why you're tired. And shortly after I had my second child, I actually went to my primary care physician complaining about how exhausted I felt all the time. And they did lab work to kind of rule some things out. Everything came back normal. So, I was told you're probably just tired because, you're a mother who's working all the time, and that can be very exhausting. Around this time as well, I was also diagnosed with 2 different autoimmune systemic joint diseases, ankylosing spondylitis and reactive arthritis. So from that period of diagnosis of those 2 joint diseases until closer to present time, the excuse was, well, your sleepiness is probably just chronic fatigue because of your joint diseases, and also the medications that I was on for controlling and managing my joint disease, as well as the pain. So as that, continued on, and I continued with working full time, I had changed positions and I was in front of the computer more. I struggled to stay awake in front of the computer in my office. Again, presentations at work, constantly struggling to stay awake through those. And it was about a little over 4 years ago when I started my current position working in clinical research. And our department supports clinical research throughout our entire hospital institution. And just by chance, I was assigned to work with Dr. Morse and help her get a narcolepsy clinical trial up and running. So as I started working on this narcolepsy clinical trial and I was reading more about the disease, because I really didn't know much about it at the time, I started kind of relating to some of the descriptions that were explained, about this disease. And I was able to relate, but I knew that this disease was super rare. So I just told myself, there's no way you have it. It's a very rare disease. It was also around this time that I started to experience cataplexy. At the time, I didn't know that that's what was going on, but looking back, I now realize that's, kind of when it started. The clumsiness, dropping things, I kind of rationalized at the time that it was my joint diseases and, my joints in my hands just weren't working right. And that's why I was dropping things. So, as time went on and we started this clinical trial, I started to meet patients who also had narcolepsy, and hearing their stories, I felt, that I could relate to what they were experiencing. But I tried to rationalize it and say, well, what they're going through is way worse, or I don't experience, those symptoms to that degree, or because I didn't experience all the symptoms of narcolepsy. There was no way that I had it. So over this time, Dr. Morse and I started to, become very close outside of work, and our families spent time together, our kids spent time together. And as we got closer, I was sharing with her some of my experiences. And my family was sharing my experiences, or their experiences with what I was going through. My husband, even my children were telling her, that mommy sleeps all the time, or mommy's really clumsy sometimes and she drops things a lot. My husband was expressing to her some of the struggles at home because of my sleepiness and my nightmares. And yeah, at that time, Dr. Morse said, I think I see some red flags. We should probably pursue things and look into this. And at that time, I told her, that I was scared to pursue sleep studies, because I was afraid that if I would go through with these sleep studies and everything came back normal, then what? Am I just crazy? Am I just lazy? And, she was great and reassured me that what I was experiencing was not normal. And even if, the sleep studies came back inconclusive, that we would definitely pursue some kind of treatment to help me feel better. So that really was the tipping point for me, where I felt like I had the confidence to move forward with getting diagnostic testing. So I went through and had the PSG, MSLT, and Dr. Morse called me right away as soon as my studies were done. And she said, "You have narcolepsy." And both of us were, I think, extremely shocked, especially that it was so obvious on my sleep studies that I had narcolepsy. But a huge part of me had felt relief, because I finally was able to understand why I was experiencing all of these things for such a long time, and knowing that I would be able to start treatment and make it better. So I was officially diagnosed with type 1 narcolepsy about a month ago. So I was slowly starting some treatment to get things under control. But like I said, without this, dynamic that Dr. Morse and I have as, a friendship, I really don't think that I probably would have pursued getting testing. So I am forever grateful, for our friendship, and that I was able to get, to this point where I have a diagnosis.
Thank you so much, Alyssa, for sharing that. And for those of you sitting in the audience going, does she call her Dr. Morse when they're hanging out? No, she doesn't.
No.
She calls me Ann. I just wanted to be a little lighthearted there for a moment. But I do want to just share that I 100% would agree with Alyssa that a part of this journey, which is incredible, of having an individual who has narcolepsy in front of my face working with me every single day, that if it weren't for the opportunities of spending time outside of work, that she did a great job of putting all of her spoons or energy into the performance of how others see her. But really struggled once at home, and without that glimpse into the private side of things, probably would have continued having no diagnosis and continue to have struggled. And I do think that it's not uncommon for people who have had symptoms for so long to go on developing the sense of, it's just me. I'm assuming the label of that I'm lazy, or this is just how I am and I'm different than others, and do have that fear limiting them from moving on to really trying to get answers. And this is because narcolepsy is a complex condition, and management require a combination of treatment, lifestyle changes, and support. And so one of the things that I would highlight is that it is really important for the patient and the provider to enter into a relationship where there is shared decision-making going on from the moment of first intake. And the reason I say starts with a provider being vulnerable and aware enough to ask things that may feel outside of their comfort zone. We're trained to ask the Epworth. We're trained to ask very specific questions that we feel are important. But patients have other questions or other experiences that are even more important to them. And so it is really important for, if your provider isn't asking you, what is the consequence of your narcolepsy? What is the consequence of the excessive daytime sleepiness or the cataplexy? Or for your provider to feel as though that they need to understand or frame it in what is the impact of your life, that becomes really important, because the medication I choose, the lifestyle recommendations we discuss, those are all going to play into what is the specific journey that you're going through. And if you meet one person with narcolepsy, you've met one person with narcolepsy. Every individual's journey is different. And so looking at lifestyle changes such as scheduling naps, developing a good nighttime sleep habits, managing physical activity, all are things that can help in making you much more energetic and functional during the day. And some of the treatments may focus on how to treat your excessive daytime sleepiness by giving treatments during the day, and as well as others that may be able to give treatment during the night. It is really important to always consider social supports, and support groups can be extremely beneficial to help develop coping strategies and connect with others who may be able to offer emotional support and helpful resources. They sometimes are able to give you resources that maybe your provider isn't able to provide, because we are not necessarily individuals living with narcolepsy and don't have the same experience that someone who does has. Time doesn't have to be the enemy. This is something I've learned every single day that I take care of individuals with narcolepsy, is that time does start to become the enemy because they feel as though there's just not enough of it. And the spoon theory of making choices, of having to say, I only have 2 spoons left. What do I decide to do with them? So some tips to consider that may help you achieve more natural sleep. You definitely want to make sure you're planning your day. You want to try and go to bed and have good sleep hygiene, doing the same things day in and day out. And avoid eating large meals, caffeine, and alcohol before bedtime. This is only going to ruin your quality of sleep, whether you have narcolepsy or not. And when talking about good quality sleep, I do want to reflect on one of the questions that came in earlier, asking about whether or not individuals with narcolepsy can get good restorative sleep. And I will say, many individuals who do have who are experiencing therapeutics that can influence their sleep and how restorative their sleep are, can experience much more restorative sleep than an individual who is untreated. And the other question that had come in was, is sleep fragmentation exclusive to narcolepsy? Although it's one of the key features in narcolepsy, it's not exclusive to it. We can see it in obstructive sleep apnea, restless leg syndrome, even in some individuals with insomnia. I also have gotten a really great question asking about the positive motor phenomena of like the raised eyebrows and arm movements and a tongue sticking out. Could this be related to the progressive neuronal death of the hypocretin neurons in the hypothalamus? That's a great question. I don't think we have an answer to. And is there a time when these extra movements may discontinue? Yes, we do see that many of these individuals may have this early on with the onset of symptoms, and then may extinguish over time and become aware of that typical negative motor phenomena or those episodes of weakness. Thanks for the questions and keep them coming in. So in terms of lifestyle changes, are there any lifestyle changes you have found to be helpful so far for you, Alyssa, that you think have made a difference? And with that, how do you try to optimize your sleep routine? And have you ever taken notes about your sleep that maybe since the last time that you and I have met clinically, have you been taking notes that you perhaps want to share with me at the next visit?
Yes, so definitely looked into some lifestyle changes, and in our discussion, as patient and provider, I found that napping in the afternoon, to help me feel rested and get through the rest of the day works well for me. I've been keeping track of the times of the day that I feel most tired, and found that if I can try and get a nap in during that time period, I'm able to help, function the rest of the day, as well as, speaking with Dr. Morse, the provider, explaining the different times of the day and what I'm feeling, I feel like helps us optimize treatment with medications as well. So having that conversation of, I feel this way during this time of the day, or I feel this way, later on in the day, I'm getting sleepy at this part of the day, helps us adjust medication treatment to kind of optimize my functioning during the day. So definitely keeping track of sleep patterns, whether it's at nighttime and during the day. Because I think sometimes we forget about the nighttime experiences that we have and focus, mostly on the daytime. But definitely having notes to kind of guide the conversation of what's going on during the day and the nighttime have definitely helped with optimizing treatment.
Thank you. I think those are all really great points, because you're 100% correct. Many patients will bring to the attention of the provider how their daytime function is, and that many times is because there's that leading question: how are you doing during the day? How are you getting your work done? How are you? And we're not asking you necessarily all the questions of other things that may be bothering you, and you may not think to bring them up because if they didn't ask, maybe it's not important. So I strongly encourage that. Recognizing there's only a few minutes left, I do want to get to a couple of the additional questions that have come through. One is there any information pertaining to managing narcolepsy through perimenopause or hormonal changes? I'm finding my sleep is more fragmented than usual. This is a great point, and one that you definitely should discuss with your sleep medicine doctor. We recognize in narcolepsy that you're higher risk for other comorbid sleep disorders like restless leg syndrome and obstructive sleep apnea. As women go through menopause, they are actually more susceptible to experiencing obstructive sleep apnea. And so if you are seeing a more non-restorative sleep or fragmented sleep, I would strongly recommend talking to your sleep provider about that because you may need a repeat sleep study. And I agree with you. In question 5, Alyssa had 17 years from symptom to diagnosis. Mine was 12 and diagnosed in 1972. I thought medicine had progressed, so that now it would only be 2 to 4 years. Today, it's so common for a long time before a condition is determined to be narcolepsy. I agree with you. It's extremely disheartening, and part of the reason that I think a person like myself and Alyssa want to share with as many people who will listen about the journeys and what can be done to shorten that journey. I sometimes feel like I want to nap, but I'm unable to fall asleep. Should I still try to nap even though it can be frustrating? Definitely not. If you're feeling frustrated by it, try and do something else that perhaps may allow you to either get a little bit more of whatever it is that you're trying to do. But if you're really feeling so sleepy and that you're not being functional, then I would recommend trying to do something that helps you to wind down, looking at things as like white noise or maybe meditation that may help you just close your mind for a moment. Engage with your doctors to discuss your treatment priorities and make shared decisions. It's really important, and I emphasize this to all of my patients, is that I may have information because I've been educated on narcolepsy and the treatments available, but I'm not the individual living with narcolepsy. And so I really ask my patients to be the captain of the ship, and for me, just be their first mate in this journey that they're going through, so that I can give them options of which course we may be able to go together, but that they're really helping to drive the decision making. I think it's important for patients to feel empowered and activated as a part of their care. And so it is really important that when you go to your appointments, to go with notes, because many individuals do suffer from brain fog or feeling distracted or disorganized. And so make sure you're keeping yourselves notes and sharing those notes with your doctor and explaining to them the things that you're continuing to struggle with. It really is important for there to be a more holistic experience for individuals with narcolepsy. Alyssa, is there anything that you can't do because of your narcolepsy?
Definitely. For sure, I can't drive for long car rides. Luckily, my husband gets car sick if he doesn't drive, so he kind of takes over when we go on trips and things like that. I can drive short distances, but I found anything long distance, I cannot drive because it's unsafe. How sleepy I get. I can't read a book. I don't know the last time I actually read a book because that is a trigger for me. Sitting down and having usually like a paperback book really puts me to sleep. But the biggest things that I can't do, but I'm working on, is definitely trying to be the best mother and best wife, or the mother and wife that I want to be. I've really struggled with that for a long time because of my narcolepsy, but I'm definitely seeing some, positive effects because of the treatment that we've started. So I'm hopeful that, I'll be able to move forward being, more of what I want to be because of our treatments.
I love the fact that you reframed what you were saying. You initially said the best mother and best wife. And then you said, actually, the mother and wife that I want to be.
Right.
And I think that's the piece that is so empowering, is that instead of this false sensation of being an artificial figure, of really defining those outcomes as to what it is that you want to achieve, because then that's something that becomes tangible. And again, I think those are really key points to make for our patients who are listening to this presentation. So these are some helpful resources that I think will be great for any of you. Visit narcolepsydisrupts.com and sign up to receive a sleep diary and symptom diary. Again, I think this can be very, very helpful for your conversations and shared decision-making with your provider. And other helpful resources, of course, Narcolepsy Network, can't say enough about them. The sleepfoundation.org, as well as some of these other NIH resources. Today has been really quite a wonderful opportunity for us to share what the journey is. And I really appreciate all the questions that have come in. It looks like we're just about out of time. And I do want to give Alyssa an opportunity if she has any closing comments that she would like to share with the group.
Sure, absolutely. First of all, thank you so much for everybody that tuned in. I feel very honored that I'm able, to speak and share my journey. And I'm so thankful for Dr. Morse and everything, that she has done for me, and that I feel very lucky to have her in my life. And we appreciate the questions coming in. And we hope that everybody is able to tune into what's going on here at the Narcolepsy Network conference the rest of the day.
Awesome. Thank you all. And I really appreciate it. I apologize for any questions that did come in that we were unable to answer. We really appreciate your attendance, and I hope you enjoy the rest of the conference.